I'm Dr. Ugochukwu Egelam. I'm the program director for the Cardiovascular Disease Fellowship and also the medical director for the LVAD program here at Northeast Georgia Medical Center.
Yeah, my name is Dr. Sherry Dodu. I'm one of the cardiology fellows here at Northeast Georgia Medical Center.
With regard to cardiovascular disease and how research makes a difference in terms of what we do, I think there are several layers that we could look at. For one, as a physician, as a clinician, as a scientist, we're always curious. We always want to know what's going on with our patients, what new therapies and options we can provide. So research allows us to have exposure to new therapeutic options that we can bring to the care of the patients. I think other things that may be helpful is as we do research, new questions develop from that. And not only are we able to develop treatment for current diseases, but we may find new therapeutic options for patients that have those diseases. Additionally, I think when patients come to our facility for care, it allows us to expose them to a wider variety and a range of options that they can benefit from to have some treatment done for them. So in multiple layers, I think it really overall improves the care we provide for our patients.
So from the fellow perspective or the fellow's perspective, for us as trainees, as you already would know, our field in cardiology is, it's spearheaded by research. And for us as trainees, it's important for us to be exposed to, one, how the research protocol is instituted, how the questions are generated, how what methods can be applied to answer those questions, and how we're able to put together the results of those research and also present those research in local, regional, and national meetings, and how all these come to play when it comes to patient outcomes in terms of making patients feel better, making them live longer, and decreasing disease morbidity and mortality. And so for us as trainees here in Northeast Georgia, we're given the opportunity to be part of that research team. And I think it serves us well in terms of our training.
So I think one of the common questions that comes up is, how do we decide what exactly we want to study, and how do we make that decision, and what processes we go through? I think for us, it varies on multiple levels. For myself as an advanced heart failure cardiologist, I spend a fair amount of my time taking care of patients that have that disease. So as a result, a lot of the work I do is relative to that patient population. I think the other things that come to mind is as we take care of those specific patients and we look to see what problems these patients have and how they're feeling, we're able to identify gaps in their care, and we're able to identify areas that have not been as well studied and areas that may lead to improvement and some sort of outcome. So that's really the crux of how we decide what areas we need to end up studying. It's always that important question that goes back to the patient.
Yeah, and from fellows' standpoint, for us, it's mainly stemmed from our interest. So earlier on in our training, we meet with our program director to explore ways or various interests that we may have and various questions that research endeavors can answer. And so our program director, together with the research department, would help us formulate a research question that we can answer, and formulate a plan or a research protocol that can effectively answer that question, and how we're able to gain or obtain our results and put the results together and also be able to present. And so for us, it's mainly based on interest and the resources that we have in terms of Northeast Georgia Medical Center, Georgia Heart Institute Research Department. And so that's how we're able to come up with the various projects we have.
So as we do our research, there are several things we do to ensure that it has a positive impact on the community. I think one aspect of it is making sure that the research we're doing is clinically relevant. it's going to answer a question that helps us improve patient care. But I think the onus is on us as well. As we do research and we generate manuscripts and publish it, we go through that process of going to meetings and presenting information so others can benefit from it, and also going through the process to make sure we create a manuscript and get it published. Because once it's published, then that kind of gets that information out there to all other clinicians who may read the information and then use it to help patients. So that's really a big part of that process.
Yeah, and also from the fellows' viewpoint, as we develop those questions, sometimes we come out with QI projects. And one of the unique aspects of our research program here at the Northeast Georgia Medical Center is that we get the ability you have the opportunity to implement that QI project in real time to see how those research findings benefit the patients here in the hospital. And so then when we present it in regional meetings and national meetings, we know that it's benefiting our patients and therefore can potentially benefit other patients. So that's one unique aspect of our research program here at Georgia Heart Institute.
In terms of the level of support and resources present at the Northeast Georgia Health System, I think there's multiple layers to it. So we have the whole dedicated research department for GME, i.e. residents and fellows. So through that, Dr. Louise Jones and her team of coordinators and research experts, the fellows and residents are able to meet and have discussions. And through that process, number one, they find out is the project worthwhile, if you will. And then secondarily, they're able to work and create a standardized protocol on which the fellow resident can go through and really follow the research method to the T and do it in a scientific manner. There's very other support. So if someone needs a statistician to help with statistical endeavors, we have access to that. There's resources that allow us to apply for grants to support the research that we do. And I think to kind of top it off, we do have a research day that happens once a year where fellows, residents are able to present the work that they've done. So I think it's really a well-run program that at the end of the day really imparts a lot of knowledge for the fellows and really allows them to grow their research acumen. And I think the level of support we've had has been phenomenal.
Yeah. And one of the things that also helps is the department that helps us to create data to be able to obtain that data from with combination of databases and things like that to kind of help us streamline that process and coming out with a research finding.
The other thing I'll add to that, of course, is the mentorship our fellows receive from our cardiology faculty. So we have several faculty mentors who work closely with the fellows and guide them as they do their research projects and help with giving them pointers in terms of presentations and things of that nature. So that mentorship, I think, is a very important aspect as well. And we have really dedicated faculty who stepped up to help to make sure that this happens.
Okay, and like Dr. Igelom said, that process is very early on in our training. So when you start off as a cardiology fellow, you meet with Dr. Igelom, who is a program director, and he would, based on your interest, be able to match you to an appropriate faculty that would kind of guide you in the process. The good thing is that it's a lifelong relationship you form with a mentor, and so you meet with them anytime, whatever time or whatever place or setting. You just let them know, and they make themselves available and meet with us. And so those are the things that kind of make our program unique.
So one of the research that we worked on recently, which I think is really impactful, is in the field of heart failure, more related to a disease entity that we call cardiac amyloidosis. And really, this is where proteins in the body deposit in the heart and causes a lot of heart muscle damage. It's a growing field in heart failure, and it's an area where a lot of doctors are not necessarily aware of treatment options, and this diagnosis is frequently missed. But thankfully, through a program that we have here, we're able to identify a lot of patients and get them on treatment. So one of the vexing questions in this field is for patients that have cardiac amyloidosis and perhaps have more advanced symptoms. They have a lot of heart failure symptoms. They're in and out of the hospital. They may require specialized medicines to keep your heart pumping. One of the questions we had was this medication, tafamidis, does it help that subgroup of patients? And as a matter of fact, in the initial trial that was done, those patients were relatively excluded from that study, or in some regards were a small subset. And there's a question of, do those patients benefit? So we did an analysis and we looked through all the data available nationwide. And as we looked at it, we've actually seen a signal that this subgroup of patients may actually benefit from being on this medication. Dr. Dodu, do you want to add some more pointers to that?
And the benefit was across board. So the patients lived longer, the patient had fewer hospitalizations, the patient felt better, and those benefit translated, whether they were mild, moderate, and even the advanced patients that we were interested in, advanced disease patients we were interested in. And the goal is to be able to present that data, and we submitted it to AHA, and we'll get it. We're working on it to get it published.
Yeah. So again, that's information that we now have that will immediately impact how we care for patients. So if I'm seeing a patient today in clinic, I have enough data that tells me that, hey, this patient likely would benefit from it. And as a result, we don't exclude patients that may benefit from this therapy because previously we didn't have the data. So now we can talk to patients and say, hey, look, we've done our own analysis, and based on the work we've done here, we clearly see that you would benefit from this medication. Let's go ahead and start it now, and then look forward to the symptomatic benefit and for the patient doing much better. Yeah. We really pride ourselves on being innovators and really being, part of where the heart's headed and what the future of cardiology is. So research, I think, is really a part of that part of that linchpin, as part of the whole process. And it really allows us to look at patient care in a whole different dimension, figure out what some of the key problems are. And as we project forward to the future, we're able to do research and get some of the answers that we need to really take care of patients today. So research really allows us to fulfill our goals and motto as the Georgia Heart Institute.
Yeah, and for us as trainees, you get to be a part of it. And so hopefully if you end up being a cardiology fellow here at Georgia Heart Institute, you get to be a part of this process of formulating questions, coming up with research protocols and findings that hopefully would impact the lives of your patients. So we encourage anybody out there interested in cardiology to apply to our program, Northeast Georgia Medical Center Cardiology Fellowship, and you can be assured that you would end up being a global leader when it comes to cardiac health or heart health for your patients.